Hello everyone, and thank you so much for joining us. This is the Essential Substance Abuse Skills webinar series, and I'm Kate Trams, and today Sean Bear is going to speak to us on on group counseling. This training series is brought to you by the National American Indian and Alaska Native Addiction Technology Transfer Center. We are part of the ATTC network, which also includes 10 regional centers and a network coordinating office. To learn more, please visit our website. This series is designed to be a broad overview to assist in preparing for written alcohol and drug certification exams, to enhance existing knowledge, and to improve overall competence and treatment outcomes. Please be aware that this series is not meant to stand alone, and previous education and training is necessary in order to pass alcohol and drug certification exams. Our center is a NADAC certified educational provider, and CEUs are available on request for a $15 fee. A request form is available for download in the Files pod in the webinar screen, and we will also be sending this in a follow-up email to all who attended. Immediately following today's webinar, you will be redirected to our GIPR evaluation. This survey asks about your satisfaction with the event and will take less than 10 minutes to complete. We thank you in advance for helping us to improve our programs. You will be muted for the duration of this webinar, so if you have questions about the presentation or about the Adobe Connect system, please use the Q&A or chat pods by typing them in the field at the bottom. We will address your questions at appropriate points during the presentation. Today's speaker is Sean Bear. He is the co-director of the National American Indian and Alaska Native ATTC and has been working in substance use as a counselor and for many years, and his passion is to assist people in overcoming their substance use issues as well as other issues and to return to the spiritual ways of their ancestors. So I want to welcome Sean today and thank him for sharing this information with us, and I'm going to pass things over to him at this time.
Okay, hello all. Again, this is Sean Bear. I'm with the National American Indian and Alaska Native ATTC for approximately 4.5 years now. So, beginning this group counseling overview, part one is how to. It has to do with types of groups, how to select membership, the implementation, and some of the facilitation by facilitators. Part two is group work with Native clients. It's not necessarily all about group work, but talks a little bit about communication styles, cultural considerations, engagement, and Native retention strategies. Okay, so beginning by types of groups, the first one here is psychoeducational. So with this one here, remember, it can be used for specific issues. It can also be used for teaching healthy coping skills, to expand the awareness of our clients, to address substance use and problematic behaviors. Skill development, the purpose is to cultivate skills, to achieve, maintain abstinence, operates from a cognitive behavioral orientation. So you'll see that from the psychoeducational, it can be more of an education where the facilitator takes the role of a teacher. So in this here, they can actually be utilized in more of a school type setting, an office or something like that, with people sitting kind of behind the teacher. Remembering that some of these groups are a little bit different. So when it has to work with like counseling groups and things like that, normally what happens is, depending upon what the group is for, the purpose of it, you may sit in a circle. One thing to take in mind though is if it's like some of the support groups, some of these other kind of groups, if you're using two people, a facilitator and a co-facilitator, remember not to sit beside each other. You really want to be able to sit across from each other within the circle. Sometimes you might be able to take cues from each other. Maybe one can look at the time it has remaining, something like that. So with cognitive behavioral groups, focus on providing structural environment within the group members. Can examine the behaviors, thoughts, and beliefs. So we're also looking at body movements and not just what people say. Support groups, the origins, come from the self-help traditions, such as AA. Also would like talking circles. So with that, a lot of it has to do with unconditional acceptance, inward reflection. Okay. Here's where we're talking about a little bit about counseling groups, but remembering that with counseling groups, some of these can be done for relationships. Whether somebody's working a group within the group is working on relationships or overcoming things within a relationship, such as even like marriage or something like that. They might come together as parents. Maybe people want to learn a little bit more about parenting skills from other parents and a facilitator. These might be working on anger. So all the group members there may be having some issues with anger within their past and come there to be able to help one another to be able to overcome that. Or such as grief. So a lot of times members might come together to work on grief. If they do this with a facilitator, then of course it'll be a little more guided that way. There's also the psychotherapy groups, working on a little more issues that might need a little more help from more of a psychotherapy or psychotherapist to help those people, as well as to listen to others within the group, find out what worked for them. Sometimes within the groups, there might be people who have knowledge further along that might help other group members. Maybe it's their first time. So looking at group membership, what you want to be able to look at too is whether this is going to be a fixed or revolving membership. Whether these people are going to be able to come and go as they see fit, or within a closed format, the group begins and ends with the same membership. So some of these, maybe if they miss so many times that they're not allowed to go in there anymore. But a lot of that will be based upon how the group is set up. Of course, open format, people might come for a while and then leave. So these are kind of revolving, where it goes on for a very long time, I guess, but people come and go. Looking at the group membership as well, the pros and cons of an open group. So an open group, of course, the members are going to be dynamic. They're going to have new members quite a bit. Clients do not have to wait for services. They're able to just step into the group and start to work with those processes. The cons of this is that dynamics within the new group. If you always have people coming and going, there could be issues with certain clients. Maybe some may not always follow the rules, or with confidentiality, of course. Clients may have to wait due to the size of the group. So maybe these clients need that assistance right away. With a closed group, improved group cohesion. Learning builds on previous meetings. The cons of this is the participant time that they can commit to. So if they only have a certain time that they're able to go through, whether this is for 10 or 12 weeks or something like that, they have to be able to commit to those meetings. The client has to wait to enter. So depending upon how many groups that are going on, they if there's only one, they might have to wait until all them groups are finished before they can start the next cycle. Okay, part of the group membership, whether you accept applications for certain groups or whether this is for treatment itself. That's kind of like where you're looking at this, is that before placing a client in a particular group, the provider needs to consider the client's readiness. Are they ready to be able to share within these groups? Client characteristics or needs or preferences. Are these group members going to be very similar in their needs, or is it going to be many topics that can be brought up? Clients may need to move to different groups as they progress through treatment. So sometimes with these groups, as people maybe they go through levels within a treatment. So some of these levels might need to be set accordingly, or if everybody's going to be in the same group, so that you have people who are new members and listen to those who have been into the treatment for a while can also be beneficial. Okay, so there are also voluntary groups and then involuntary. But remember, with involuntary groups, sometimes they might feel coerced into being involved in the group. So right away there can be resistance. But overall, you might have better outcomes during the end and see how different people are able to change during that time. There are also legal obligations that they might need to attend to, family pressure, or any external motivating factors that can lead to the client's resistance. Well, if a family member or court is making them go, then of course they don't feel like they have a right, so they're there and they may be angry. So there's also self-motivation to change. These can also impact the group culture and the norms, whether it kind of goes on to other members, or maybe some of the clients or participants are, their motivation is growing, whether they're still in preparing or preparation phases. Maybe they're going to move into an action phase, but sometimes because of others' motivation may bring up older kind of thoughts, they might kind of go back a little bit. But of course there are those who are at other levels. It can actually make them inspire them or motivate them to move forward. Okay, so voluntary group members often assist in providing motivation for pre-contemplators and contemplators, can serve as effective mentors in group with other group members. Self-motivation to change can inspire other group members and positively impact the group culture and norms. Kind of like what I said with the involuntary. Some of these factors can come into play, but the longer normally this group is going, sometimes those cohesion within the group kind of grows. But it may also depend whether it's an open group or closed group. Okay, so with group membership, clients often indicate primary mode of help is through mutual support. So in other words, it's not the facilitator that is most important, but the mutual support. People begin to help each other. Many clients like to hear what has worked with other people, so that they might be able to try that. Some things that looks like we have somebody who has no audio on their telephone. I'm not. Let me see. Okay. I guess they have access to computer audio. Okay, so we'll continue on. So many people, they like to see their classmates. They also like to see other people within the group that maybe they feel akin to. So also looking at different groups, I mean, sometimes there might be people meet to have coffee. Maybe they meet to have book clubs or weight loss groups. So sometimes the content helps as well as seeing peers. So sometimes if they were able to get a topic that everyone feels a little more kin to, that it could be very helpful. So that will be part of the planning for the groups, is what kind of members are you going to be selected to be able to enter these groups, or as if it's going to be an open group and anyone can enter. Okay, so again, with group membership, members who self-reported improvement were statistically more likely to have felt accepted by other members or perceived similarity of some kind of group members. This made specific references to particular individuals when queried about the experience. Some may have felt more committed to particular individuals. I think it's just like as we're having friends and people that we work with, or peers or something like that, sometimes we see a little difference within also personalities, because sometimes the personalities of a person really makes a difference in whether somebody's able to open up a little more, or to be able to take advice from that person. I think there was some kind of information before, it was like, I think it was 70% of, or maybe 60, somewhere around 60-70% of group rapport or counseling rapport with a counselor had more to do with personality than education. So this can be something that might come into play. Okay, group membership, self-help versus mutual help. So a self-help implies that the individual in treatment is the main contributor to the change process. Mutual help means that individuals also assume partial responsibility for the recovery of their peers. So if the group feels dedicated to each member and not just themselves, it may drive them to be able to help these other members so that they might succeed within their treatment. Okay, so part of the implementation of groups, as facilitators, we're responsible for establishing parameters for the group, providing general behavioral expectations while clarifying the purpose of the group. So some of these can be guiding the group members, saying, okay, so we all want you to understand about confidentiality. Would you want people talking to others outside of the group about what they heard or seen here? With that helps to guide them to be able to make either group rules or group norms that everybody's supposed to follow. Here it's saying it's good to be able to call them group values. What does a group value within this group in order for it to be successful? So remembering that ethics still apply as these groups are formed. Being the very first group, they'd want to be able to make these rules and write them out so that these rules are being shown to everybody on there and that they've agreed to it. So also with that, needs to be looked at if people are break any kind of confidentiality, not coming to group, not sharing, or resistant or argumentative in the group or something like that. They need to be able to discuss that right away and what they're going to do under these circumstances. Is this person going to be asked to leave? Are they going to get another chance? A lot of those kind of things come into play with implementing these kind of rules. Okay, so implementation of groups. Try not to make group values too complicated or too restrictive. So focus on member safety, honesty, integrity, and respect for self and others. Some may really value punctuality to begin on time and end on time because it might show others that showing up on time that you actually care. Of course, with some native participants or clients, this may vary. So are you going to start out with some kind of group activity in the beginning and move on to more of a group counseling atmosphere? This is something you kind of think about. Okay, values clarification. Ask, what do you mean by establishing some parameters for the group? Why do we want this for the group? So sometimes within this, they need to understand what this means. Because if they've never been in a group, they might not be able to see how this happens. Sometimes people might call each other out. Is this what people want? So if that is okay with everybody, then those are something they could be added into the group. Because it's always, some people find it helpful when people are with more experience there are able to call people on things to make them be a little more honest about it. Okay, so also remembering that amendment of these group rules can change over time. If they might see something that needs to be added or maybe adjusted or deleted. You might be able to review this each meeting if necessary, as well as to again remind the clients of mandatory reporting laws. Okay, so implementation of these groups again is, these are some examples of group rules. A lot of times many people want everybody to be willing to self-disclose. Also, if you have group members that have been in groups before, sometimes if each might be able to share over time a little bit about why they're in the group, sometimes that opens up room for accepting feedback, or maybe others will want to be able to speak about that as well. But allowing others to speak without interruptions, that's something very common within Native communities, because, and maybe this is something where they hold something in their hand, kind of like a talking circle, so that they know that they're the ones who's speaking and nobody can interrupt. It also allows people to be respectful of each other. Okay, a little more about implementation of the groups. By providing initial overview, both individually and in groups, clients then come to the group with appropriate expectations. That's something we want to be able to find out before we're actually adding them into the group, so that they are in an appropriate setting for them. So if you're having applications to a certain group, that is something that might be part of that, and let them know what the appropriate expectations are at the beginning. Clinicians and clients can expect a greater degree of success this way. Okay, so these are some other terms within groups that tend to come into play. So forming. As a group is formed, there's usually apprehension on part of both the leader and the group members. Clients may not be sure how they fit in. It might be helpful to draw out natural strengths that they don't realize they have. So this might be some of the discussion within some of these very first groups, is to have a little bit of introduction, or whether this group is going to be more focused on certain issues. If this is focused on a certain thing within the group, that might be helpful to let them know as well. But then again, it's also what the group members might want. If this is something that they all want to be able to focus on, how to overcome certain things within themselves, or what they have been through, maybe it's around a certain topic, that might be helpful to be able to speak about in the very beginning. Storming, maybe a comfortable place for clients to have conflict between group members. Rephrase something in a respectful way, may also question the role of the facilitator. Conflict can assist in bringing group members together, though. Conflict may indicate that someone cares enough to be concerned. But remember, those kind of things are things that need to be kind of brought out, how this is going to be done. Whether they should just say you and pointing a finger, or maybe they should just be how they're going to do this. Are they going to be talking to other members about certain people? Many times they would rather have somebody be able to speak to a certain person face to face in a way. That way you're not talking about somebody or pretending they're not there. That's a little more respectful. Okay, say norming. This normally happens after the storm. It's a period of evenness and calmness prevails. So after there's been some difficulty, sometimes it allows people to be able to understand that maybe they didn't see a certain point of view. But I think many times, many people are the same way. It's like we don't always see ourselves in how we act, or how we might say a certain thing. But if we look at that from another person's point of view, we may see their point and saying, well, I can see how you would come to that conclusion, but this is not that's not what I meant. This was not my intentions. So sometimes those things can be kind of talked about. Performing, everyone knows their roles and rules, and the group now motors along towards achieving its task. So this is kind of like, in a sense, where people are following the rules and being able to move towards more of a group cohesion. So the people are beginning to follow those rules that everybody had agreed to in the beginning, and people are beginning to respect one another. They're able to help one another and learning how to speak to one another and how to help others. So adjourning is when you're getting done or getting close to the end of either a session or at the very end of all these groups. So how do you know when a group is done? Does a facilitator decide or does the clients decide? But sometimes they might also have only a certain amount of groups set in the beginning, whether you're going to have 12, 13 groups, so that in the middle, maybe somewhere, you might be able to start planning that ahead. Start to let people know that as the group is going on, eventually we're going to meet that point. So we would like maybe more people to be involved in the group, to move that process along for them, to help them and guide them for that, not to just make them do it. But at the same time, it's like when you're getting towards the end, maybe the 3/4 away through or 2/3, you might be able to say, let them know, eventually this group is going to end and we want to start moving towards that. But at the very end, maybe the last couple groups, people might want to start to plan on that, because as some of these groups go on, these kind of, especially with closed group, they begin to build a group think. They're all aware of everyone. They're more motivated towards one another. They want to help one another. They feel a lot more close to one another and want to help them. And this is where this kind of part comes into, is group cohesion. So it builds over time. Feel it is a warm and supportive environment. Group norms are accepted and shared by the group. Group think. Members become to set aside their own thoughts and follow the support of the group process and members. Risk taken within sharing becomes common, and each member has become trusting and respectful of the process and its members. So these are kind of things I was speaking about the ones before that. So usually these are kind of milestones within the group, because we're moving towards more of this process, and this is a time when a lot of things can be done, although many times it can take a lot longer, and it might happen just before this group ends. So again, I was saying is they become closer, it might be harder for them to end that group, so to prepare them for that. Again, the best way to end a group is to plan for the finish at the beginning, particularly for native clients. Even if many of these members are from different tribes, there always tends to be a friendship building within there, in a sense, where they have seen others and realized that they are often more similar than they are different. Here's some stages of the group development and leadership roles. We spoke a little bit about this. So we'll go a little bit over the group membership behaviors. So with forming, dependent upon the leader, uncertain what to do, searching for other strong leaders within the group members, because sometimes these will be the ones that help to guide it. Rebellion with storming is testing the leader skills and authority, sense of apathy or hopelessness. Norming, a sense of enthusiasm. Members are beginning to take more responsibility for the leadership of the group. Okay. a little bit more about performing with group members, a sense of getting the job done. Problems are easily overcome within the groups. Little need for the leader's intervention. Um, Adjourning, maybe they're reminiscing about what has happened early in the group. Planning reunions. Group members often deny the end and make plans to keep in touch. There may be some regression to former problems of patterns of behavior. Remember, with this, we also need to remember that change is difficult. It might have been very difficult for them to be able to start the group, but as they got used to it, again, they have to adjust, and this change process is going to take place. So that might be part of the regression. Okay, so a little more about the implementation of groups is in creating a group, remember that in most cases, you are the single common element among all the group members. And this is the facilitator. They've all met you before. So they might all be looking at you in the beginning. But also, as time goes on, they begin to look more at one another. You'll see where people are becoming close to one another or looking to another for leadership in a sense. You'll see them make more contact with one another or really pay attention. Okay, in shaping the group, your experience and behavior, as well as the expectations of group members, will guide the formation of the group. So you might be able to ask the clients, tell me more about that. Eventually going on, these group members may ask a little more of the same questions. So it's kind of a teaching at the same time as they begin to be in a little more shape and use the same kind of techniques that the facilitator is using to help elicit more information from them or help them to be able to see or know how to react to certain things. Remember, we don't want to, if somebody's trying to shock us, we don't really want to be shocked, So a lot of those, the clients may take into consideration and be able to utilize the same techniques. So in maintaining the group, we as a mediator, we're handling issues that might arise which threaten the group cohesion. Our job is to help the group function properly by showing confidence in each one's abilities and ourselves, remaining calm and objective, and providing a safe environment. So we need to be able to be looking at everything going on within the group to make sure that if we see any kind of trouble areas that we can interject with that, or to be able to bring something to help mediate that. Over time, group members will see how this is done, and they will also be able to use that as well. Common tasks of a group facilitator, again, maintain a safe environment. Serve as a group historian. Maybe they summarize at the end of each group. This is something that's very common within individual counseling, is to be able to summarize what you've heard, because that helps all the clients within that, or even just one client in an individual counseling session, to realize that you were listening and you heard and you understand a little bit about this and how it's going on. Helps the clients remain in the here and now by redirecting or bringing them back to the purpose of the group. Helps clients discover answers for themselves. Remember, we're not really here to solve another person's problem. The best thing is to be able to have the clients solve them problems on their own. Although, even though we might want to be able to say something, we can't always do that. We need to be able to help guide them towards that change. Remember, it's okay to have fun. Have a sense of humor, but use professional judgment with that. Remember to redirect war stories of the past, of what was lost, and the overwhelming task of looking for the future years from now. Because a lot of times war stories may actually grow then more, and then everybody's telling war stories. It's something that we sometimes want to stay away from most of the times, because we need to be able to guide the group so that they can complete what they've come here to do. If you can get group members to I statements, you are doing well. Okay, facilitator and co-facilitator. Remember, this is kind of going to be dependent upon what kind of group it is. If this is more of an educational group, a classroom format, maybe useful. But for more counseling kind of situations, or to build a help, to build that other group where people are helping one another, a circle works very good. But remember not to sit beside each other. It's better to sit across from each other so that you can give other ones cues. Give the other presenter or facilitator and co-facilitator cues on what should be done, or to be able to realize what's going on, to watch the time. Okay. One of these is a little bit different because one says facilitator and co-facilitator. I would suggest that both the facilitator and co-facilitator thank the participants. That they should both help with the cleanup. And because sometimes the facilitator and the co-facilitator, the way they're seen, one might at times may have said things that allowed the client to realize things in another way. And sometimes even the personality may be beneficial at certain processes. So I think that both of them should be kind of doing it the same way and kind of complete the debrief process. Okay, so we're getting to work with native clients. Can be very difficult in sense in any country, because remember, it's all these different tribes are going to be very different. They're all going to be having their own kind of beliefs, language, customs, practices, so it can vary. Although one thing I've noticed is that even when you're speaking about language and beliefs, even though these are different, or in a way they say them differently, explain them differently, when it comes to more of spiritual things, they kind of explain it the same way. So that can also be a very similar place. Okay, communication styles for natives cannot be generalized. Remembering that we all have different languages, we all have different ways that we might react to certain things. Remember here, though, that if a Native American person looks away, this may also be a sign of respect. Remember, especially early on, you might not have many natives who actually look people in the eye. So normally someone who's older may be speaking to somebody who's younger, and of course the younger person kind of might look down or look to the side or something like that, because they're trying to be respectful. And sometimes this may be the same thing with facilitators, co-facilitators, counselors, or something like that. Native people are sometimes taught that listening rather than speaking immediately is important, and personal information about oneself and one's family is not easily shared. So remember that this may take much longer for people to be able to share about themselves. They may be more inclined to be able to listen more than others may. Some of those differences is also comes into play is between traditional, assimilated, and bicultural individuals. So this can also come into play, remembering that not all natives might have been raised the same way. Okay, silence or minimal sharing should be interpreted as disinterest or an indication that nothing is wrong. That's not always the case. Sometimes it just takes a little longer to build a trust. Sometimes maybe it has more to do with personalities or what's going on, but over time, this may actually grow. So where English is the patient's second language, the speech may be thoughtful and slower. Many natives are thinking, in a sense, while they speak, to be able to plan what they're saying comes out correctly, so it doesn't just come out and sound disrespectful. Some native people, especially elders, may believe that talking about a topic, certain topics, will come true. There are people within the native culture that believe that if you talk about certain things, it may actually cause it to happen. So someone may not want to speak about that. And that's something to be aware of. Some more cultural considerations is remember that there are Native Americans or American Indians. They might not all want to be called Indian, or they might not all want to be called Native. Remember there are Alaska Natives, Native Hawaiians, First Nations, or other such as indigenous. So each person is going to be a little bit different in how they define that and within themselves. Also with how they self-identify might be different as well, even within one tribe. Okay, so make the numbers actually higher here. I think it was than it was before. 562 federally recognized tribes. I think that had grown a little bit. There are more tribes that are gaining the federal acknowledgement and stuff like that and being federally recognized. Alaska Native and Hawaiian, there are 223 tribal communities in Alaska and within the Hawaiian Islands. I know some of these, even in Hawaii, they do have Native Americans out there that are even having powwows that they are doing this with the Hawaiian peoples. Clinic experience, whether it be bio, psychosocial, and spiritual, build upon and fosters positive therapeutic relationship. It builds trust. That's very critical. Increases the likelihood of treatment plan adherence. Reduces client attrition. Keeps them coming back. As many times, it's like spirituality was not always being able to be spoken about in many of the different cultures, but usually within tribes, this is something that might come out. And if that's the case, where culture, spirituality come out, the clinicians, psychiatrists, doctors, counselors, they need to be aware of this and to be able to learn from the tribal peoples, and so that they can build a better relationship, but also be able to help them a little better in understanding that. Remembering that it reaffirms the clients as experts in their own health, our mental, behavioral, spiritual experiences. Remember that the native clients of these people are really the experts of their culture. In doing so, we help clients make positive changes in their lives, increases their motivation. So how does this fit in the native worldview? Most often, working effectively with native people requires a shift in the delivery of our services. So how do we work from a culturally relevant our perspective? So part of that is we need to be able to look at the cultural teachings. We need to look at spirituality as part of a holistic approach to wellness. Remember that our cultural teachings can be learned, but also ingrained in the community. Remembering things around the examples of death or birth, puberty. Sometimes there are certain ceremonies that not everyone is always privy to. So these are something to learn from the tribal members themselves, so that you can understand that. Appreciation and respect for nature, environment, and the surroundings. So it's not something like if people are smoking and they throw their butts on the ground. There might be people living while you're littering the environment and hurting nature. Appreciation and respect for our health, body's mind, and our connection to the past. And this really kind of comes into play with historical trauma, because the beliefs and knowledge and the histories and things that natives have or share are not always shared by other cultures. So remember to be able to learn about that and be a little bit more cognizant of that. This was what this person Matt had said before. In his experience, taboo subjects can include HIV, as opposed to diabetes, sexual behaviors, particularly with LGBT communities, drug use, general issues of modesty and privacy. Remember, with cross-gender communication, modesty is not about shyness, but about respect in others. So, in some of these, there might be some kind of education that might need to be done across different areas within behavioral health, substance abuse. A lot of times, not everybody is in agreement with many things, but they look at many of the Two-Spirit teachings, and it says there's so much information there that not everybody is taught about some of the older Two-Spirit teachings. Is very interesting to learn. So native specific cultural risk factors, they are very not always very trusting of confidentiality. There may be a lack of social services on the reservation, just as it is with rural. Limited access to comprehensive health. Circular migration, whether they go from urban to rural and then back to urban again, or the other way around. Unresolved trauma, historical or otherwise. It's remembering urban relocation programs, the boarding schools, history of abuse, sexual and otherwise. Also comes into place with racism, homophobia, xenophobia. With racism, in a sense, it might even come on play within tribes. Even though that there are people, maybe all the members there are all native, but they might not all be full-blood. There might be half, a quarter. Whether it's also about those that are enrolled or not enrolled. Remembering that these kind of things come into play, and there is kind of discrimination in a sense amongst them as well. So be aware of this. It also lets you have an opportunity to provide culturally respectful, meaningful mental health services. There's a pervasive and ongoing need for native-centric or culturally sensitive mental health services in research and anecdotally. You have the ability to know and understand trends and needs. That's a key role. Especially with mental health, many of the older generations did not trust mental health services because from just our culture being shared alone, within like the DSM-5 now, could be meet the criteria for a mental health disorder. Remember, many times assessments were not always created or made with natives in mind. It was usually tested with other cultures before they brought it to the tribal peoples. Okay, confidentiality for some native clients is an absolute barrier to care. Even walking into a facility, because people might see who goes in. Native people may have a personal or family experience of breach of confidentiality with people maybe within next door to the treatment center, or if it's attached to a hospital or anything like that. People may see one another, or even within the program. It is critical we maintain the highest level of confidentiality if we are serious about improving the quality of life for all people. Using culture to help engagement process, help with introductions. This might be something at the introductions to allow people to hear about that. Reaffirming them as experts in their own experience, but also in their own culture. Spirituality might begin groups with the opening and closing prayer. A lot of times, even the smudging or something like that, where people will speak the truth and be respectful because of the prayers and the things that are going on with there. Many of the tribal people are going to be very respectful of that. Remember the 10-second rule, especially for elders, is after they've done speaking, give them a little more time just in case they start to speak again. Sometimes they're just thinking about what to say. Have a referral list to local organizations. It's very important for non-natives and people outside the tribes to be able to show up to native events in the community. Being seen within the community helps tribal members to be able to recognize people and to understand that they're not there just for the money, that they're there to actually help. But remember, it's a two-way street there. With many tribes, they might need snacks or water. It's very common. It's way back, and I think even like the 1600s, where tribal members came to certain people back then and brought them food and gifts. It's pretty interesting. It's way back in history, and it's still going on. Look at incentives, maybe books or something like that. Transportation, food, gift cards. So sometimes if they come from a long ways away, it's just like with certain healers or something, they give them money for transportation or something like that. Or maybe they help them to get there. Maybe they're going to provide the transportation. Make sure they try to help build relationships with the community leaders. Being consistent is vital when trying to build relationships with the tribe. Give ample time to process information, to ask questions. Getting local organization support. Reach out face to face. Many times natives would rather reach face to face than over the phone or on an email. Okay, so we are at the end of the webinar. I thank you all for listening. I think I'm going to be sending out a thing for the Gipper form. Could all fill out. If you could really fill that out, I'd really appreciate it. I hope you enjoyed the meeting or this webinar. Please let us know. Okay, you should be reaching another message soon. All right, thank you very much. Have a nice day.